And thank you for your patience. We're going to start the March block coordinated access, and I do have everyone in muted mode. This is Jennifer Paulson, and I'm with Texas Homeless Network. I'm the Director of Development and Training here, and welcome. So today we have a great webinar on coordinated access. So I just want to go over some housekeeping things, and I will be recording this webinar. And oh, sorry about that. So when it starts, I will let you know. All right, we've got your microphone will be muted, and I already told you that. You can type in your questions at any time. At the end of the webinar, we will take the questions, so type them in at any time. We are recording now. And the recording of this webinar will be available. We'll send out a link to everyone. So the first thing we want to do is to do a poll. So I'm going to poll you guys and see, and I'm assuming that this is a yes, so. All right. And we'll let you guys attend or answer that for a few minutes. And a couple more seconds for that. Okay, 86% of you have voted, 67% said yes, and 33% said no. Well, for those of you who have heard of it and think it might be a dirty word because you're not sure what's going on, we hope to dispel that. So today, best practices, we're going to go through this. The Continuum of Care Interim Regulation defines a centralized or coordinated assessment system to mean a centralized or coordinated process designed to coordinate program, participant intake, assessment, and provision of referrals. A centralized or coordinated assessment system covers the geographic area, is easily accessed by individuals and families seeking housing or services, is well advertised, and includes a comprehensive and standardized assessment tool. Centralized or coordinated assessment systems help communities to systematically assess the needs of program participants and effectively match each person or household with the most appropriate resources available to address their needs. Providing appropriate housing and services ensures success in moving people out of homelessness and increases their housing stability. So today we have Mary Dotson, LMSW with Texas Homeless Network, and she's going to talk about this coordinated assessment and help us all understand it. So I'm going to switch my screen to her, and we'll let her, let's see, take over. Okay, Mary, did you get the, you should be seeing that.
No, I do not have control here. I'm seeing your information on the screen.
Not yet. Okay, so let's see if it'll do it. All right, you should be able to do it now.
Yes, there I am.
Yay.
All right. And Craig, can you tell me again how to get this slide without these on the left?
Which slide, ma'am?
The large slide to be the only thing on the screen.
I'll be right to your office. Give me 2 seconds.
Okay, I'm sorry guys, technical difficulties. I'll introduce myself while I'm getting some technical assistance. Mary Dodson. I'm the COC manager here at Texas Homeless Network, and that means that I do all kinds of things related to COCs. And I started here in October. And I've been working on 2 projects. One is called SHIP, the Statewide Homeless Initiative Project, and that is where we're working with the 12 COCs around the state to assess their readiness for complying with coordinated access, the COC interim rule, and readiness to administer emergency solutions grant. I also work on the coordinated access project, which is partly why I'm talking about it today. Our main staff person for coordinated access, though, is Sophia Cheka. She happens to be out of town right now, though, so I'm filling in for her. But we've been working with consultants from CSH and about 9 communities around the state so far to implement coordinated access. I am a social worker by profession and training, and I formerly worked for TDHCA in the state HPRP program. So I know many of you from that work. Also prior to that, I ran a day shelter for homeless adults. And prior to that, I worked for the city of Austin with COC planning. And prior to that, I was a homeless education liaison in the Bryan School District. So homeless services is my passion, and I'm very grateful to be at THN doing what I'm doing. So let's jump into coordinated access. You'll see here we're specifically focusing today on the implementation of coordinated access within the Texas Balance of State COC. We're going to do a little bit of coordinated access overview. I heard in the poll that some of you have not heard of coordinated access or coordinated assessment before, so this is a good time to pick up some of the basics. For those of you who have heard about coordinated access before, or maybe you're already even implementing it in your community, we're going to be reviewing some concepts that might sound familiar to you, but if you just hang in there with us, we're trying to reach as broad an audience as possible. Then we'll talk about kind of the 4 A's of coordinated access: access, assessment, assignment, also known as referral, and accountability. And all of this will be in the context of the model we're using, and again, in the Balance of State, or BOS, COC. All right, the 2 groups that have been working on this for Balance of State are Texas Homeless Network, or THN, and our mission is providing solutions to end homelessness in Texas communities through education, resources, and advocacy. And you'll see here our handy-dandy map of Texas with all the COCs identified. The Balance of State COC is all of those counties in orange. You'll see there are 213 of them. So we've got a lot of space to cover. Now we're not in every community yet, but we're getting there. And then you'll see the others areas that have their own color assigned are the other 11 COCs in Texas. CSH is our consulting partner on this project. They are a group that advances housing solutions that improve the lives of vulnerable people, maximize public resources, and build strong and healthy communities. CHS is working to solve some of the most complex and costly social problems our country faces, like those related to homelessness. They envision a future in which high-quality supportive housing solutions are integrated into the way every community serves the men, women, and children in most need. And they have certainly been excellent partners with us. Okay, let's get started on the overview of coordinated access. Within the Balance of State COC, a Coordinated Access Steering Committee was established mid-last year in 2013 to really start developing a coordinated access system. Now, this was based on HUD's regulations and requirements that COCs develop a coordinated assessment system or centralized intake. It's been referred to as a number of different things. Within the Balance of State, we call it coordinated access. So it is that same concept, just our name for it is coordinated access. And then the steering committee reviewed various models and selected one with the understanding that we wanted the coordinated access system to be mostly standardized for all the communities within those 213 counties of the Balance of State COC, but also having room for flexibility to tailor the system somewhat to local needs. And one thing you'll realize as you work more with coordinated access or coordinated assessment systems, flexibility is key to making the whole system work. We're starting with a design that we think will work in most communities, tailoring it to those communities, but then as they implement and over the years of using coordinated access, they'll be refining it as they go to best meet their community's needs. All right, the Balanced Estate project started with 3 pilot communities. So these are our first communities where we're implementing, and those are Texarkana, Corpus Christi, and Denton. Those communities actually started operating the coordinated access systems on March 1st. So they've been going for almost a month, learning lots of lessons along the way that we're going to be able to use to refine the process even further for the next set of communities that we're helping. Okay, some of the guiding principles around coordinated access. We want to focus on solutions with a housing emphasis. So really looking at what can we do in terms of providing housing and services to go along with that housing to end people's homeless situations. We want to try to allow for consumer choice whenever possible in terms of which program or project they get referred to receive services from, the geographic location of those, and the kinds of services that they're most interested in. We want to ensure that coordinated assessment or access system within a COC is used by as many groups as possible within the COC, those that are COC funded programs and even some that are not COC funded, similar to how we would like lots of our agencies to be involved in HMIS even if they're not COC funded. We want to make sure they include an open, transparent, and consistent way to ensure that all programs are using the system. So just kind of an ongoing observation and providing technical assistance where needed to make sure that programs are understanding how to operate and that they're, if they're having any challenges, that we get to address those very quickly. And of course that they contain a uniform intake and assessment form. And on that note, I want to clarify that when we're talking coordinated access, the uniform intake and assessment form is one piece, and it's not the main point of doing coordinated access. The main point is really to try to make the best referrals we can that match a person or family in need to the housing and services that's going to best meet their needs. So we'll touch on that throughout this presentation, that referral or assignment as one of the A's is the most critical piece, or maybe the biggest change from how COCs are operating now, because a lot of COCs and communities within the BOS are in fact coordinating very well. So their access and assessment might be more coordinated than in some other places, but it's really that referral piece, getting clients to the right services and housing that is going to be an area for growth. All right, coordinated access, what is it? Well, in short, from the HUD definition, a centralized or coordinated process designed to coordinate program participant intake, to coordinate assessment, and to coordinate the provision of referrals. So you'll see in a few minutes we're going to look at this a little bit more in depth and what does that actually mean to coordinate the process. Also, as Jennifer mentioned earlier, we need to make sure that the system covers the geographic area, is easily accessed, is well advertised, and includes a comprehensive and standardized assessment tool. Those are the requirements exactly from the Continuum of Care interim rule. All right, so Again, why are we talking about coordinated access? Well, for one, HUD is requiring us to develop it. But the reason HUD wants us to develop these systems is that research shows that coordinated access systems help communities to end homelessness. And much of that research came from the HPRP program. I'm sure many of you participated in that in some way. So why do coordinated access? Well, it helps to move people through the homeless services system. Again, we're trying to streamline the efforts where there are fewer sort of intake points to the homeless service system or access points. And so people know where they are and they can get there, and there are maybe fewer agencies doing the intake, so that can free up some of those agencies' time to do the next step or the next step in the process. It assists communities with ending chronic homelessness. We're serving clients effectively, and the big one for me, making a better match of services to the client's needs, which results in reducing the returns to homelessness. And that is one of the Hearth Act's main goals, is that we want to have as few people as possible returning to a homeless situation after we've tried to serve them with housing and services. So if we can make a better match of the person to housing and services, then research has shown we will have fewer people returning to homelessness because those interventions will meet their needs. What it might mean in some communities is that we identify more gaps in your housing and or services that are really needed by your clients to best meet their needs. But we will have the data to show that, and you can use that in your planning and your fundraising, your advocacy for your homeless services. All right, so let's look at how many COCs might be currently operating. You'll see this one person might get cycled through the system from the street to transitional housing to friends to shelter to some other sort of temporary or short-term housing solution, and maybe cycling, but never truly getting out of homelessness, or maybe not getting out for any length of time. Sometimes too it depends, which agency the person in need approaches. That might influence how, what kinds of housing and services that they get referred to. So coordinated access, I love this graphic. I think Nicole from CSH created it. To me, this one is really helpful in trying to envision what coordinated access is. You'll see at the top we have persons experiencing homelessness in blue, and persons at risk of homelessness on the bottom in green. So both of those, people in both of those situations could go into the coordinated access system, which we have here in pink. And that's where we'll do the assessment and try to determine the best housing exit strategy so people can get out of homelessness. All right, so some of our options are transitional housing, rapid rehousing, permanent supportive housing, homelessness prevention, and community supports. So let's kind of start at the bottom. The people at risk of homelessness in green, through the coordinated access system, are going to be assessed to see if perhaps their needs can be met by other community supports where they wouldn't enter the homeless services system at all. Let's say maybe the person is at risk of homelessness because they're behind on their rent. Well, if there's a community support that could provide 1 month of rent for that person or that family, that might be all that person needs in order to get back on his or her feet. And so we would want to try that route first if that best meets their needs. Similar to homelessness prevention efforts, particularly if you have a program that is funded as homelessness prevention, that opens up more opportunities for you. Then the top 3 categories of housing, those are really geared for people who are already experiencing homelessness. So transitional housing, which is short-term, rapid rehousing, which is getting people back into housing as quickly as possible, and then continuing with some sort of subsidy and assistance for a short term. Permanent supportive housing, however, is for those folks who need supportive services offered to them for the long term. So again, just kind of a visual representation of how someone might work through from being in a homeless or at risk of homelessness situation into being housed or prevented from getting homeless on the right side of the chart. So when we're looking at this, for many of us, it's a strategy shift. On the left, we're showing what the current system is. In a lot of cases, it's more about eligibility. If someone in need arrives at a service provider's location, the questions might be, should we accept this household into our program? Or sort of, are they eligible for our program? That model is program-centric, not system-wide. It might mean that every organization in your COC has its own forms and its own assessment process. It doesn't necessarily ensure that a match between what the person needs and the services that are available happens. And there might be what's called uneven knowledge about available housing and service interventions. And that refers to the fact that maybe there are some case managers who know more services or resources in the community than some others, and it's kind of the luck of the draw about which person you get or which agency you're eligible to work with. So for the future system with coordinated access, what we're looking at is the main question being, what housing and service assistant is best for each household and ends their housing crisis quickly and permanently? So it's a very different question. And this means that we have a client-centric and system-driven approach. So there are standard forms and assessment processes used by every program in the COC and for every client. And that there's a coordinated referral process that has been designed ahead of time by agencies participating in the COC, so that the idea is no matter which access point a person arrives at, they will get the same kind of assessment that will result in the same kind of referral than might have happened without coordinated access. And we want to have the information about available housing and services in the COC very accessible. In many cases, that's going to be done through HMIS, but of course we're working with communities where we want to make sure we're including victim services providers. So that's a whole area of planning unto itself, but we want to make sure we're ensuring confidentiality and safety. All right, again, kind of back to this guiding question, what housing and service assistance strategy of the services that are available is best for each household? And then we're going to have as core principles standardized access and assessment and coordinated referral. And those cover 3 of our A's: access, assess, and assign. And then applying that to the balance of state, we're looking at access points. A few access points will be selected for each community by their CAN, we're calling it the Coordinated Access Network on the local level. During assessment, we're going to eventually have intake and assessment in HMIS, incorporating victim services in some way that is yet to be determined. And we're focusing on diversion and prevention as much as possible. So helping people maybe identify family members or friends or coworkers that they might be able to stay with rather than entering homelessness. Or, is there some way that we can maybe work with a landlord or a relative, if they're living with a relative, to do some mediation and see if there's any way at all that we can help this person not enter the homeless service system if their needs can be met outside of it. That sort of preserves the homeless service system for those people who really have no other options. All right, assigning means that we'll just, it's the referral process, and that is all spelled out in the assessment forms. And accountability is the fourth A. And that's really, okay, who is looking at whether or not the coordinated access system is working, how successful is it being, what challenges are we seeing, what great things are we getting accomplished, and modifying the system over time to make sure that it really is reaching our goals. All right, now here's the really handy-dandy flow, also similar to what questions you might ask yourself when someone arrives. So the left half of the page here is relating to a household that is in a homeless situation. And on the right is that the household is not yet in a homeless situation. So let's look at the left. If the household is already in a homeless situation, we want to ask, what is the best fit housing option for them? That's the first question. Then once you know that, you ask, well, do we have any of that available in our community right now? If the answer is yes, then you make a referral for that person to that housing. If no, does that person have somewhere else to stay while they wait for that kind of housing to become available? If yes, then you have them stay there. If not, you try to find shelter space in your community to short-term shelter them until the type of housing that is the best fit for them does become available. And I know this isn't an ideal world. Again, we may come to realize in some communities that we don't have enough permanent supportive housing or rapid rehousing projects. And that's where we can go back to stakeholders and say, look, these are the kind of housing interventions that would best help 50 people get out of homelessness in our community, but we only have 10 units of that, so we need 40 more units. All right, and then if the household is not yet homeless, but at risk of homelessness, or you ask, are they at risk of homelessness? If yes, what kinds of support do they need to avoid homelessness? If no, what community resources could help address their situation? So for example, if you have someone coming to the organization that says they need food assistance, well, but they're not at risk of homelessness, then you might refer them to a local food pantry instead of a homeless service. All right, I know we've covered a lot of information very quickly, but we have a poll question for you guys. So Jennifer, are you going to run the poll?
I am, so let's see. All right. Okay, we're going to give a few minutes for people to vote. Or a few seconds. Minutes seems a lot longer when you're looking at seconds. Okay, about 40, now we're up to 60% voted. Okay, and I'm going to close the poll, and 81% of you voted, and it was 100% true.
Great job, everyone. In trying to pick out the poll questions, this is a very complicated topic, and I was having a hard time finding a question that wasn't extremely complicated itself, so good for you. All right, now we will move into the 4 A's. First one is access. So as you can imagine, the word access means how can we best help people gain access to the homeless services system. So it is the entry point for individuals and families facing a housing crisis to determine whether the homeless assistance system is the right place to serve them. So again, we might have people arriving at in our communities looking for homeless assistance or some other kind of assistance, and we are trying to decide, okay, how can our community best serve this person or this family? Access models vary by site location, number of access points, the services offered at the access point, and the type of organization overseeing each access point. So you may have heard of some of the different models. In the balance of state, we're using a multi-door approach where it's not a one single point of entry into homeless services. So in other words, we have more than one agency in a community identified as being the access point where people would come to seek homeless services. We're also not doing what's called an open door, or sorry, no wrong door approach where every agency in a community serves as an access point. We're doing a middle ground where in most of our communities there are between 3 and 6 access points. Many of them have identified a victim services provider as one of the access points. Many of them are choosing 211 as an access point. Anyway, so models vary, but that's how we're doing it in the balance of state, at least to begin. Okay, some characteristics to look for in your access point, or in other words, what kind of service or agency might make a good access point. We would want it to be easily accessible to people seeking services. So transportation is key. We're also looking at things like ADA compliance. So if someone has a mobility need, our site is accessible. We would want the access point staff to be culturally appropriate or culturally competent. We want that agency to have active participation in the COC and in the case of balance of state in their regional homeless coalition. Also, we need them to be an active participant in HMIS, unless of course they're victim services providers who can opt out of coordinated access. But to have a true community-wide approach, most of the communities we're working with so far really want to involve victim services providers. So we're having to take a lot of time to figure out how we can best do that from a safety perspective and from a data perspective. And those are some of the steps we're still designing. And of course, an access point would need to have frontline staff whose time is dedicated to intake and to the coordinated access process. Again, in a lot of cases, 211 will serve as an access point, and the degree to which they can assist might vary, but what we've talked with 211 Texas about is putting enough information in the descriptions of our access points in the various communities throughout the balance of state so that the 211 call specialists can get a person, refer them to the right access point in their community. So that's an exciting partnership. All right, the next A is assessment. So once someone has gained access into your homeless service system, at that access point, you're going to want to do an assessment of their needs, just like you would do, or you probably already do in your agency. We want to look at what their homeless history and housing history has been and any barriers that they have to either obtaining housing or maintaining housing. We'll certainly want to discuss any safety concerns and perhaps offer that person the opportunity to be assessed by a victim services provider rather than a non-victim services provider. We want to identify appropriate services using the consistently used or standardized assessment tool. We're going to capture data that we need for program needs and funder requirements. In a lot of cases, that will just be the universal data elements in HMIS. And then obtain the person's consent for sharing their information. Again, we're really trying to focus on confidentiality. Then we want to explain a little bit these 3 assessment phases. At the access point, or in this first stop, we're going to be doing a crisis assessment. And that's how will a client's crisis needs be addressed? Their immediate need for some place to stay and for safety. Then secondly, we'll look at a housing stability assessment. What criteria for different types of housing and services will help to create a referral match? So just as you do in your current agency, this is going to be a kind of a community-wide effort to look at, okay, based on the assessment questions, what type of housing and service is the best fit for this client? I have to give kudos to Houston. Sophia, our coordinated access specialist, was with some of the Houston folks when they rolled out their coordinated access system, and they gave a really great example where one of their intake workers, she asked the person seeking assistance to look at all of her answers to the assessment and determine for herself, based on those answers, what she thought the most appropriate housing intervention would be. And so we want the assessment to be that kind of clear that, okay, here are the questions, and then based on those, here's the best type of housing that would meet your need. But I thought that was a very empowering way to handle that. And then once a person gets referred to a housing provider or service provider, that's when a fuller client assessment will happen, a more comprehensive assessment of what other kinds of things are going on with the person, what other considerations are there that we would need to know in order to develop a longer range housing plan in which the person would be able to maintain housing stability. So we get to that really in-depth assessment, but only after the person has been referred and gets received by the agency that will serve them. We don't need to ask all those questions in the beginning. And I will tell you why in a moment. I thought that was the next slide, but it's not. So we'll look at here. What kinds of things can be assessed? Probably the same things you already look for. The risk of becoming homeless, the risk of remaining homeless, housing options outside the homeless assistance system, vulnerability to homelessness, self-sufficiency, service needs, health status, eligibility, income, and education. But in coordinated assessment, what should be assessed are those top 4. Again, we want to just focus on what is the person's immediate housing need right now. And then the rest we will assess at a later point in the process. And the purpose of assessing in part is kind of going back to what we talked about earlier, diversion or prevention as one option. And if that's not a viable option for the person, then we want to look at how we're prioritizing them for homelessness prevention services, shelter, rapid rehousing, transitional housing, and permanent supportive housing. Now again, we realize this is in the best case scenario in a community where all those types of housing exist. But I think what we'll see as we're going along, and some communities have already seen this, is, for example, if your community does not have any permanent supportive housing, but some of the people coming for homeless services would best be served by permanent supportive housing, that makes the case that you have a gap in your community. Unfortunately, what it might also mean is if that person who really needs permanent supportive housing, but your community doesn't have it, then if they have to go into shelter, they may not have the most successful outcome of getting out of shelter, because that's not the housing type that would best meet their need to exit homelessness and remain housed. So again, looking at the results of how can we best make a positive change in a person's life. Here's what I was alluding to earlier. It's called the tool rule. In the assessment tool, we should only include questions if the answer to that question is needed right then to determine what kind of assistance a person needs. So don't ask more than you absolutely need to know in that first assessment. All right, our third A is assignment, more commonly known as referral. And that's where, again, we want to match the recommended type of intervention to a program in the COC that can provide the right services. So, for example, if a person is assessed to need transitional housing, assignment is where you look at some of those other characteristics. Like if you have a transitional housing program for people with mental illness, but the person you're assessing doesn't have mental illness, well, then you're not going to refer the person to that particular transitional housing program. You might refer them to a different transitional housing program in your community for which they do meet the eligibility criteria. So that's what we're talking about here, matching the recommended type of intervention to a program in the COC. You know, let's say we were looking at one community the other day that had about 20 permanent supportive housing projects, which is amazing. So if in that COC someone is assessed to be best matched with permanent supportive housing, then there are 20 options that they can choose from to try to best meet their particular situation. Then the intake worker would check availability, again, potentially through HMIS, and make the referral or a direct placement if that's possible. HMIS can be used to check availability, transfer client information to the receiving program, and provide enrollment status back to the intake coordinator. So this is an example of how HMIS can be very, very helpful just in the process of assessment and assignment. And then, of course, we want to monitor to ensure that enrollment. Part of the accountability piece will be looking at, okay, if someone is referred to a program and the receiving program says, well, this person is actually not appropriate for our services, then we want to look at kind of where the breakdown was. You know, did we not ask a right question on the assessment, or was there some other piece of information missing that sort of made the intake worker give a bad match? And again, that's all part of kind of practicing with using the system and being willing to be flexible and fine-tune it along the way to make sure it's working in the best way. So again, we're back to this slide. Now that you've heard a little bit more about the 4 A's, you might be able to understand this chart a little bit more in depth. Persons experiencing homelessness or at risk of homelessness go through the coordinated access system. Based on what that assessment shows, they will be referred to the type of housing or intervention that would best meet their needs. And similarly, we have the decision tree again. You'll see on the left is if the household is homeless, and it's, you know, yes or no, and then what do you do if it's yes, what do you do if it's no, and same for households at risk of homelessness. And I want to make a point. When we're talking about diversion, we're not saying we don't want to serve a certain person or we don't have enough services to serve everyone, so in this case, we're not going to serve you. It is not about that at all. It is really about preserving the homeless services system for the people that need it the most. I'm guessing many of you had practice with that in HPRP, talking with landlords and family members to try to see if you could help any other housing options for the person in need. All right, the fourth A is accountability. And again, that is all about who ensures that your coordinated access system is running smoothly. And how do you do that? It involves training, developing and following policies and procedures, maintaining really strong and constant communication, monitoring how the system is going, looking at the results of, as I mentioned, how the referrals are being made. Are people getting referred to the right places? Are people getting enrolled in those programs? So again, just following along to make sure that the system is working. So you can establish a process for determining if it's working, monitoring the system, and then refining the system based on the data that you're getting back. This is a piece that we also have not fully designed, and so as our projects have begun, 3 of them began in March, 3 more will begin, well, maybe not 3, in May, and then by the end of July we should have 9 communities up and running with coordinated access, and we're looking very forward to seeing what all they're learning and how we can keep refining. So THN will be doing site visits and monitoring. We'll also be looking at HMIS data once our HMIS piece is fully implemented. And then on the local level, we have these coordinated access networks, or CANs, that will do similar kinds of things, but on the local level. So kind of a 2-tiered approach. And then for the coordinated access networks, we're looking at them developing a process, making sure they have the right kind of people on the CANs, or the right kind of representatives, having frequent meetings and communications with each other and with the COC and their local coalition. Lots of communication going on. All right, and then just kind of in summary, I really liked this phrase, or these paragraphs from the National Alliance to End Homelessness. Coordinated entry offers a more organized, efficient approach to providing people with services and housing by creating quicker linkages to programs and matching people's needs to providers' strengths. So again, trying to find the best fit or the best match of a person in need to what your community has available. When implemented effectively, it simplifies the roles of providers, shortens the path back to permanent housing, and fosters a sense of system-wide responsibility to assist every person, regardless of the complexity of their situation, into permanent housing as quickly as possible. So again, looking at all of us in the community and this person as our client, not just a client of one agency. All right, so I've put some resources here for you. These are 2 very short videos from HUD that talk about coordinated assessment, the models and principles, and the philosophy. And we think those are excellent little introductions. And then for those of you ready to move into some details, the National Alliance to End Homelessness has a coordinated assessment toolkit that has lots of resources on 6 topics that you see identified there. So once you're ready to really dig into the nuts and bolts of creating a coordinated access system, this is a great place to start. And there is my contact information. Again, I'm Mary Dodson, the COC manager, and I work very closely with Sophia Cheka, our coordinated access specialist, and Eric Samuels, our Balance of State COC director. Okay, second poll question.
All right. So, and I apologize, apparently the other one didn't come out all the way, so I don't know what happened, it cut it off. But this one you should see the entire question. So what are the 4 A's of coordinated access? So I'll give you guys some time to answer. I like the third one, Mary.
I don't see it on my screen.
Oh, probably not. I know for some reason it doesn't show up on your screen, but it is,
right.
Yes. But I do like the apples, apes, articulation, and anchovies.
Chris added a few options. If you guys don't know Chris,
gotcha.
He is our resident comedian. He told me he added a few.
Okay, so we're going to go ahead and close. It looks like 81%, 84 now voted. And okay, so it looks like most of you chose the second one, access, assess, assign, and accountability, and that is correct. Okay, Mary, I'm going to read some questions. The first one is wondering what are the thoughts behind a few access points and not standardized intake and assessment across the system, making all points access points?
Well, what we have found is that having a little bit more containment is more manageable for a lot of our communities. So rather than having, say, 15 access points that are all trying to do the same thing, you can get the same effect without so much complexity of coordination by narrowing down the number of sites. So the idea is still there, that you are assessing a person the same way across the entire COC, but even if you have, let's say, 3 access points, those 3 access points are assessing people on behalf of the entire COC. Again, potentially freeing up some staff time in those other 12 agencies that doesn't now need to be spent on assessment, because that piece of the work across your continuum is being done by only those 3 access points. So again, it feels a little bit more manageable for the communities that we've been working with so far. But it is up to your individual community. There's a broad range, again, between the single point of entry and the no wrong door, which is every agency is an access point. What we also want to do is try to have the access intake workers be very skilled and very well trained, and trained in the same way so that the person seeking services really is getting the same kind of assessment at each of the access points. And that becomes a little bit more difficult the more access points that you have.
Great. Then the next one is on your coordinated access flow chart. And there was a question, do they have somewhere else to stay while they wait? And they're wondering, doesn't that equal not homeless, if not a shelter or hotel paid for by agency?
Well, yes, the way that if the person is in a homeless situation already, and let's say their sort of best fit housing option would be transitional housing, but either you don't have any or you have some but there aren't any beds available in it right now, what kind of the default plan is to ask them, do you have possibly anywhere, or is there a shelter bed available in our community? If so, the person would go to that shelter while they're waiting for their optimal type of housing. If there is no shelter or bed available, then you would try to work with the person to see, is there any other place at all that they can stay until that housing does become available. Again, this is likely already happening in many communities, but perhaps we're not systematically tracking it. so that we can see, oh my goodness, 20% of the people that come to our community for services, we're not even able to shelter them on that night, even though they need it. So what this partly coordinated access is trying to do is, again, tying the data very closely to what it is your community already has and is working well, and what your community needs to develop to best serve the people who need you in your community.
Great. Now, there was a question, what makes someone at risk for homelessness?
That's a very good question. Within coordinated access, we are following the HUD definition of at risk of homelessness. And I'm sorry to say I don't have that paper right in front of me, but they have a handy-dandy little check sheet of things that make a person at risk for homelessness. Within coordinated access for the balance of state, we are somewhat focusing on people who either are already don't have a place to stay that night, or are within 14 days of losing their place. So if they're more than 14 days away, let's say it's the beginning of the month and they've gotten an eviction notice that will take effect at the end of the month, 30 days later, then that person would not meet the HUD definition of being at risk. If they're, however, within 14 days of an eviction or losing their housing for some reason, then that would meet the HUD definition of at risk as just kind of one factor. But I would refer you to HUD's website, OneCPD, that's ONECPD.info, and look up at risk of homelessness.
Okay, and we can also share, we'll share some of this information as well, so we'll send that out to you guys.
Oh, yeah, great, and maybe with a link, too, that they can just click on.
Yes, exactly. All right, I don't see any other questions, so that looks like that concludes the webinar today. Thank you, everyone, for joining us today, and if you have any questions, you can email, again, mary@thn.org. Can answer questions. Mine, it's just our first name @thn.org, so Jennifer@thn.org. Or if you have training questions from Chris, that's Chris@thn.org, and you'll also get that in your follow-up email. And I want to thank you for spending an hour with us this afternoon. Goodbye.